Hello and welcome to ukfitnesshub.com. My name's Travistarrant, and in today's video we're going to be covering knee osteoarthritis. We're going to be going through what the causes are, what knee osteoarthritis is, and some of the best exercises and stretches explained that you can do to alleviate your symptoms. Let's get into the video. To start this video, let's talk about what knee arthritis or osteoarthritis is. So in my hand here, I've got a model joint of the knee. You're looking at the front of the knee here. At the top, we have the femur, so your thigh bone. Below that, we have the tibia, which is here, and we have the fibula bone. So the ends of these bones are aligned with smooth articular cartilage, and over time that can wear and degrade, and that causes arthritis. So a lot of the time with osteoarthritis, we're seeing bone on bone, which causes inflammation and then causes a lack of strength and mobility through the joint, which is what we're going to work on later when we go through our exercise and stretch regime. It's important to note that we have different types of arthritis and different causes for arthritis. So for example, rheumatoid arthritis, we can have arthritis caused by trauma or infection in a patient's life. There's sometimes a genetic component in some patients, but for the majority of patients I see, there's no obvious reason for their joint to be worn out. It's important for me as a trainer to see somebody in the early stages of osteoarthritis. So this might be someone that comes in and says, I'm starting to get pain when I run or when I walk. At the latter stages of a walk or run, then all of a sudden you get the other extreme of osteoarthritis where somebody is so bad with their osteoarthritis that they cannot even get up out of a chair or they can't even straighten the knee without pain. Those types of clients often we refer on, so that would be to a knee consultant to talk about whether it's steroid injections to bring down inflammation and reduce pain, or alternatively partial and total knee replacements, which I'll do a separate video on. When it comes down to the vast majority of my clients that are managing knee osteoarthritis, the main goals are going to be to restore function of the knee, so to make sure the knee is as strong as possible. Also as well, make sure that the joints above and below it, so the ankle and hip, are functioning well, because imagine the knee is in the middle of that ankle and hip, so if the ankle and hip are unstable, it puts more instability through the knee as well, and we'll cover that in the exercises. The other thing we want to do is restore flexibility, so that stiffness that people get, we want to make sure that we alleviate some of that via appropriate stretching. When it comes to clients that are managing this, the whole goal is we understand that knee osteoarthritis is a degenerative disease. It gets worse and worse. However, if we can make the knee function as well as possible, alleviate some pressure off it via making all the joints as stable as possible and start to get some flexibility through there, then we're on to a winner for trying to alleviate some of the symptoms. Earlier on in my career, when I had a knee osteoarthritis patient, what I used to do was focus on the strength of the muscles that directly attach to the knee. So the quadriceps, the hamstrings and the calves, I would try to make those as strong as possible and try to do some flexibility work with the knee. Now, however, having had hundreds of knee osteoarthritis patients, I'm focusing my programs more on the glutes more than ever, and I'm getting better results with the clients that I'm doing that with. And that's because the glutes help us with locomotion and propulsion, so when we're running and walking, they help us stabilize when we're on one leg. And also, if you think about the primary role of the glutes, whilst they do multiple things, the primary one is hip extension. So actually, when we come out of a seat or when we're in that horrible half kneeling position and we have to get out of it, that is glute strength, and glute strength is required. So the stronger we can make the glutes, the less pressure it puts on the lower back and also the knee joint. So the first thing we're going to do is we're going to start to warm up the hips. And what I want you to do before we get into the exercise is 15 repetitions, 2 sets of the following hip dynamic exercises. So I've got one hand here on an object that's not going to move. You can use a wall. And I'm just going to bring my leg side to side, and I'm going to do 15 repetitions, just warming up the hip joint. Once I've done it on both sides for 2 sets, I'm then going to come forwards and back, doing the same thing on both sides for 2 sets of 15. Once the hips warmed up, I need to work the knee. So I need to focus on extension, warming up extension of the knee, and flexion of the knee. So let's start off with extension. So I'm on a bench here, you can use a chair, and I'm going to have both hands gripping onto the bench. From here, I'm going to start to extend my knee straight. I'm going to pause at the top, really squeeze the quadriceps, and slowly come back down under control. Again, 2 sets of 15. I'm looking to try and get that knee joint nice and warm. It should feel warm after the 2 sets of 15. And then I go on to doing knee flexion. Now I've warmed up knee extension, let's go on to knee flexion. So firstly, I'm going to get my clients to lay down on the floor. And all they're going to do in this position is bring their heel to their bottom. And this is going to be focusing less on the quadriceps and now more on the hamstrings and glutes. And once again, they've done 2 sets of 15. They'll be nice and warm with regards to those muscles, ready to get onto their exercises. If you're not a fan of those last 2 warm-up exercises, another alternative that's worth knowing is we can be on something that allows us to have our feet off the floor, and we could start to just come forwards and back in that position, kind of allowing gravity to do the work. So I'm now assisted because I'm not bringing my foot to the floor on each repetition. I can swing through the range of motion, and I'll often get clients to do this on days that they're not working out, just to warm up the knee in the mornings. So this is a nice one to do, again, 2 sets of 15, and you can swap this one for the other 2. If you can do the other 2 without pain though, I would definitely recommend doing those instead. Nice one, however, to warm up the knee in the mornings. Now we're nice and warmed up, let's get on to the main workout. So you'll notice here I've got a mat on the floor for comfort. I've also got a cushion. This is optional. I like to use this for my clients just for neck support. And what I'm going to do is I'm going to put on one of these looped resistance bands. You don't have to use these, but I'm always using these with clients, even beginners, to try and really put some emphasis on working the glutes. So once I've got the band on just below my knee, I'm going to come all the way back. So I've got my head on the cushion here. I want my feet just outside the position of my hips. And the first thing I'm going to do is I'm going to pull the band out with my knees. Once I've pulled the band out, I should feel resistance, I should feel the band wanting to be coming in, and then from this position, think about squeezing your glutes. So I'm going to place my hands out the way so you can best see. I'm squeezing my glutes as hard as possible, and I'm going to come up into a glute bridge. So I'm going to bring my tailbone off the floor first, lower back and mid back, and big squeeze of the glutes. Try and keep the band coming out, make sure it's not coming in as you do the movement. And again, slowly down, mid back down, lower back and tailbone. Come back up, big squeeze of the glutes, and mid back down, lower back down, tailbone. So it's about trying to bring the hips in the direction of your head by just bringing that tailbone up first, then lower back, then mid back, big squeeze. And once you've done 2 sets of 15 repetitions, that's your first exercise done. It's a slow, controlled motion. We don't do it fast, and we do a nice pause at the top for 1 or 2 seconds. Once you've done that, you're going to come onto your side. I then like, for this exercise, to put the band just above the knee, and I've got my feet on top of each other. I'm laying on my side, and I've got my knees bent. What I can do here is, if I've got a cushion, I can double it up so I've got my neck supported. And all I'm going to do here, whilst keeping my feet on top of each other, is I'm going to bring this knee away from the body and keep this knee in contact with the mat. So right knee comes up and back down, comes up and back down. I'm not moving my whole body, so I'm not going like this. My foot's not coming off the floor or this left knee. It's simply my knee coming up on the right side, big pause, and slowly back down. One of the cheats I find people do is use the upper body to try and assist that movement, to try and keep it nice and strict, even if you have to use your top hand on the floor to really get you in that position. And again, it's 2 sets of 15. Both of these first 2 exercises are glute exercises, one for extension and one for abduction. The next exercise I'm going to do, which is my favorite and coincidentally my client's least favorite, is crab walks. So I've got the band here below my knee. What I'm going to do is I'm going to place my feet hip width apart, and notice how my feet are pointing directly forward. They're not in a squat position turned out. Now, from this position, I'm going to come back with my hips. The lower I go, the harder it's going to be. And what I'm going to do is place my right foot out whilst keeping the foot straight and left foot in. Notice how I'm doing the movement. I'm always staying in that squat position, and also I'm always keeping that distance in between my feet. So I'm not coming out and then losing resistance. I'm always making sure that I keep the same hip width distance as I do my repetitions. And what you're going to do is 15 one way and 15 the other. If you're thinking, Travis, I don't have a walkway, I'm going to be using kind of a space that's quite condensed, then no problem at all. You can do it like this, 1, 2, and go to 30 repetitions as well. Again, the whole primary focus of this is starting to get all the muscles of the legs working, and of course trying to focus on the glutes. The next exercise we're going to cover is a wall sit, and this is primarily a quadricep exercise, but we're going to put a Travis style twist in it. You can just do the normal wall sit. If you want to make it a little bit harder, keep the band on from those crab walks, and what we're going to do is we're going to come into a wall sit. So firstly, I'm going to make sure that when I come back I've got one hand on the wall for support. I'm going to make sure then I've got the whole of my head and the whole of my back in a position where they're on the wall, feet hip width apart, and I'm going to come down. Noticed here where I've got a chair, the whole reason I've got this is when clients do a wall sit and they're thinking about this exercise, often if they do it on their own, they don't want to get stuck in this position, so they know that they can really push themselves to the max, trying to go to 30 seconds for 2 sets. And if they can't do it, well, they can just sit down onto the chair. So what's the point of the band on this one that we've kept on? Well, we're going to actually try to get more glutes involved in this exercise as well. So when you're in your position, really pull the band out as much as you can to try and get glutes firing as well as your quadriceps. So when you're doing this motion, all you're doing is you're just pushing the band out. You'll feel glutes and you'll feel your quadriceps on fire when you're doing this. And if you can't get to 30 seconds, at least then you've got the security of the chair that you can use to come down safely, as opposed to, collapse on the floor, which we don't want. Whilst we work hamstrings a little bit in our glute bridge exercise, if we want to isolate them, we're going to do very similar to our warm-up exercise, that heel to butt one, by doing hamstring curls. You can do these with no weight, or alternatively, you can use a dumbbell for some added resistance. If you've got a gym, you might want to use the hamstring curl machine, and I'll put some resistance machine exercises that are good for knee arthritis in the description of this video. So what I would do with a client is I would actually set this up for them if they was training with me, but I'm going to get the dumbbell in the middle of the feet, really clasp into the dumbbell. They're going to be face down. I'll take the microphone off so you can hear me. Once in this position, front on, I'm really gripping this dumbbell as hard as I can. And with both legs, I'm going to come up at the same time. Big squeeze of the glutes when I come up to the top, and slowly back down. I'll feel the dumbbell touch the floor, and I'm pushing my feet in as hard as possible to make sure that when I'm executing the repetitions, I'm doing it under control. I'm not letting gravity bring that weight down. I'm doing it myself. And once I've done 2 sets of 15 repetitions, that would be the exercise done. I can lower the weight down under control and let go. Step-ups are a fantastic functional exercise that can be added into this training program. Of course, make sure the height of the step-up is appropriate for you, and you shouldn't be getting any pain with any of the exercises in this exercise program. So if you're finding you're getting pain, you would stop immediately. Of course, muscular discomfort and aching is fine, but no sharp pains. You'd immediately stop any of the exercises if you was getting that. As a trainer, when it comes to step-ups, what I'm looking for is I'm looking to see how the knee tracks. So I'm looking for the knee to be in line with the foot. I don't want the knee coming in, and I don't want the knee coming out and the foot coming up. So when someone comes into a step-up, I'm looking for them to be nice and upright, to come up and back down, keeping the knee straight without coming in and out. So this is nice to do in front of something like a mirror, so you've got that visual guide. Of course, once you've done one side, you do exactly the same for 15 reps and 2 sets of that. And just make sure when you're doing it, try not to lunge forwards when you're doing the step up. Make sure that you're nice and upright and you're coming up, upright, and down upright as well. Now moving on, we have calf raises. So for calf raises, find yourself a wall or a fixed resistance object, have your hands on the wall, and what I want you to do is one leg at a time, coming all the way up, big squeeze of the calf, and slowly back down. So heel off the floor, big squeeze, slowly back down. So we're doing this single leg, 15 repetitions on one side, do exactly the same on the other. And once you've done your 15 repetitions on that side, you can repeat for both sides for 2 sets. I like to make this next one a little bit more dynamic for my clients. So single leg balancing is really important to work stability of the ankle, knee and hip joint all at once synergistically. However, if I ever see a client do single leg balancing, often they look so bored when they're doing it, and also it makes me bored as a trainer watching it. So what I do is I get a wall and a ball. So this is a Pilates ball. You don't have to get one, get any ball. From here, they take a big step back from the wall. Single leg balance, get their balance to begin with, looking at a point on the wall, and they just start to do throw and catch. Once they're good at that, I'll get them to go a little bit further away from the wall. They're looking to do 15 reps for 2 sets. It's harder than you think actually, this one. Once they then get really good, let's say I am where you are watching, so I'm where the camera is, I'm the client that I'm training, I'll then start to throw the ball to the client, and they'll have to then catch the ball in different ranges and keep their balance as well. So it's a nice one you can do interactively with something like a friend, a loved one, brother, sister, whatever. However, when you're doing this, it is important that you are focusing on the exercise. If you're somebody that does struggle with balance, what you might want to do is do this within like the corner of a room, or have chairs either side. So if you do lose your balance, you can grab something quickly. So dependent on the client and how their balance is, will I trust them to do it on their own, or alternatively have them to do it in the corner of something, so should they fall, they can grab onto something quickly and of course reduce the risk of injury. It's not uncommon after a training program like that, especially if you've done it for the first time, to feel a little bit stiff and sore, whether that's directly after the workout or muscular aches days after you've done that workout. It's really important that we stretch not only for flexibility and improved mobility and function, but also as well to reduce that muscular stiffness after you've been doing those exercises. So we're going to go through some generic stretching. If one of the stretches isn't applicable for you, let me know. Maybe I can find an alternative for you, so just put it in the comments section. Otherwise, let's start off with these generic stretches that we're going to do one set of 30 seconds on both sides. I'm going to start off with the quadriceps, so the front of the thigh. And what I'm going to do is I'm going to use a pillow for my head, so my head's supported. I'm going to bring my foot back, and then I'm going to bring my knee to the back of the room. So that is my heels coming towards my butt, hands on my laces of the shoe, and from here then I pull back on my knee. So heel to butt, or as close to as possible. When you're doing this, if you can't get your heel to your butt, you're just working in a pain-free range of motion. Once you've done your 30 seconds, we would swap sides. So you can see that from the other angle. That looks like so. Then I'm going to move on to glutes. So pillow underneath my head. One ankle goes over the knee. And from here, I'm then going to pull back on my leg. You'll be feeling this in the glutes. If you don't like this one, what you might want to do is have a wall. So let's say, for example, I have my left foot against the wall. That means that I don't have to pull back with my hands. I can just have my hands to the side and have my foot resting on a wall. Once you've done that for 30 seconds, you would switch over and do exactly the same thing. Once you've done that, we're going to stretch out the hamstrings. So bring both legs down. You can have one knee bent or you can have it straight, doesn't matter. And you're gonna pull your leg back, try and keep your knee as straight as possible. You should be feeling this at the back of the leg, so your hamstring, again 30 seconds both sides. And once you've done that, what I want you to do is knee up, hand on the outside of the knee and pull over. From here, Notice how I'm keeping my eye line facing towards the ceiling. Big deep breaths and always relax into the stretches. If you're ever doing stretches and you're holding your breath and you're going, because you're really trying to push the stretches, you won't be relaxing, and therefore if you're not relaxing, how can you expect the muscles to? Finally, we've got our calf stretch, which is standing up. For the calf stretch, what you're going to do is you're going to find a wall. You're going to bring your heel as close to the wall as possible. So really bring it as far as you can into the wall. Come up nice and straight. You might already feel the stretch in this position. If you don't, you're going to bring your hips towards the wall, and then you should feel a really deep stretch. So just make sure heel is as close to the wall as possible that you can get it. I've then got my toes and forefoot on this wall, and from here, if you can't feel it, you just bring your hips closer for a deeper stretch. You would be looking to do this program at absolute maximum 4 times a week. The warm-up exercises we did and the stretches can be done daily. However, the main workout that we did, that at absolute maximum would be done 4 times a week with a day's rest in between. If I get a client come in, it massively depends on what stage of knee osteoarthritis they're at. So I just get them to do a program once, see how they respond to it. This is a generalized program. Everyone will have specific ones with all my clients. They'll have specific different exercises. But as a general rule of thumb, start off once, see how the knee responds. Often people will inflame up a little bit, they'll get a bit of inflammation after training, and actually as they start to progress their training, putting weights up, getting used to it and acclimatizing to it, they actually start to have less inflammation when they get used to the training. As a practitioner, I use ice to help relieve swelling and inflammation. I would use heat if a client was super stiff in the morning or before a training session. There are other clients that in the clinic we use things like ultrasound, electrotherapy, acupuncture, and of course TECAR therapy. So those are the things we use in clinic for aiding clients around their training sessions and to make sure that they can train even harder when they're coming in for their rehabilitation programs. And that brings us to the end of today's video. Thank you very much for watching. What I'm going to do is I'm going to put some exercises in the description of this video that are weights exercises that you can do in the gym. For example, gym machinery that would be good for knee osteoarthritis. If you've learned something new or gained value from this video, please like and subscribe to the channel for more free and educational content. My name's Travistarrant. You've been watching UK Fitness Hub, and I'll see you in the next video.